Yeah, so hope you all are doing well. Hope your practice is going on good. Yes. So you all know the topic for today's session. So it's on slip disc, backache and toothache. So those who have any issue related to spine, we're going to discuss so many things. So apart from acupressure, so there are so many other things. But before that, I want to know if anyone is facing this issue, spine related issue. Anyone? So we'll start with slip disc spine issue. Nishmita.
Yes,
Yes. Is anyone here who's facing spine related issue? Yes. Anyone? Sciatica pain. Okay, Lakshmi ji. And then anyone? Yes, I want this session to be interactive. And please switch on your camera. Okay. So, yeah, so those who have spine issue. So we all know one thing. So those who have mutton seed, dried piece, right? So I want you to just put it like a bracelet on both left and right hand. So this is the most expensive um, treatment. Okay. So what I mean is, so whenever you put mutton seed on this area, it has so many benefits. So it can be cervical pain, thoracic region, lumbar, sacral, coccyx, whatever it is. So I wanted to cover this area completely with mutton seed. Okay. Can you all show your wrist joint? Everyone? Switch on your camera, everyone. Yes. So can you just keep your wrist like this? Okay. Okay. So here exactly, I wanted to put mutton seed. So just like a bracelet. So we all know this belt, right? So those who have backache, so you put that hot belt or something, right? So it works the same way. So those who have any issue, spine issue, so if you put mutton seeds on both left and right hand, it will help you to recover faster. Okay.
Pooja,
Yes, Swati.
can we do that mutton seed bracelet at the time of periods? Because at the time of periods there will be lots of back pain.
Yeah,
Can we
definitely
try
yes.
this?
Definitely yes. Yes.
Ma'am, whether we have to put mutton seed on that points like mega meridian 1, 2, 3, 4 till 9, same
Yeah,
points,
yes,
yeah.
yes, yes. So those who have completed level 1, 2, and 3 in color therapy. So we call it as mega meridian. So mega meridians are located on the wrist joint. So here itself we have division like 1, 2, 3, 4, 5, 6. So from 0 to 9 we have division. So totally 10 points are there. So those, anyone can try this. So those who have joined the session for the first time, so even for them, just put mutton seed over here completely. Okay. Um, and then there's one more thing for slip disc. This is advanced treatment, so we use this method in third level. Okay. So those have done, this Akash Vayu Agni Gel concept, color therapy. So level 1, 2, and 3. So third level concept I'm teaching today. Okay. So I want you all to take a screenshot. So I'll share this screen. Okay. So I want you all to take screenshot. So before that, I just want to know if anyone is having backache issue, anything related to spine. Okay. Swati, yes. So can you elaborate? So what kind of pain do you have?
Uh, Actually, I get a mid, uh, ते काय बोलायचं फूट नाही का बोलायचं I don't know what to tell
Okay.
exactly. पोट दुखत म्हणे कंबर दुखते पोट दुखत.
Okay. So mid back, the thoracic region.
Um,
Thoracic region.
yes.
Okay,
I usually get that pain. Every day I get that pain.
every day. Okay. So what could be the root cause? Like you had a fall, or what's the main root cause?
No, no, after delivery I started getting this pain.
Okay.
I had two C-sections. So after that it is a regular pain for me.
Oh, okay, okay. Yes. So here the problem is C-section. So during C-section, you all know that injection they give, so they insert the thing. So it can affect your nerve. It can affect your bone. Yeah, I mean the curvature. So so there's so many so many other problems. So due to injection, if she's facing any issue, so the root cause is different. Diagnosing will be different, but anyone can try this. Trust me, just putting methi seed on particular joints. Okay. So now I want you to take a pen with you. I hope you all have pen. Okay. So this is practical sessions. I want you to do it practically. So I don't want you to take sketch pen. Take a pen, any color. Okay. So I hope you all are ready. Switch on your camera. So I don't want to say this again and again. Switch on your camera, everyone. Okay, so once you all are ready, so I'll show the picture. Yes. Okay, fine. So now, so I'll be showing one picture. So I want you to take a screenshot of that. Okay. So I hope you all are ready. Okay. Fine. So before I show the picture, I want you to put arrow mark. Okay. So it's going to be easy for everyone. So just take a pen, just put one arrow mark showing upwards below your little finger on both the hand. Okay. Pointing upwards. Okay. So same thing goes on your ring finger as well. So pointing upwards, pointing upwards. Okay, done everyone. And same thing goes for the middle finger and index finger. So all four fingers. So just put one arrow mark pointing upwards. Yes, perfect. Perfect everyone. Okay, yeah. So now the next thing on your thumb, I want you to put arrow mark which is showing downwards. So it should be downwards. So point downwards. Okay, fine. So do you know there are how many curvature when we talk about cervical region? So when we talk about cervical region, yeah. So how many curvatures are there? Any idea? I mean the bone. When we talk about cervical part, how many?
Seven.
Yes, how many?
Seven.
Seven. Perfect. Okay. So just take a sheet of paper. Just write cervical. Cervical region has 7 curvature. Okay. Thoracic region. So thoracic region has 12 curvature. Okay. So we don't call it as bone. So the medical term is curvature. Okay. So in thoracic region we have 12 curvature. So sacral region again 5. Sacral. Sorry. After thoracic it's lumbar region. So lumbar region is 5, and then sacral region is 5. So lumbar 5, sacral 5, and then the last one is coccyx bone. So coccyx means we all know it's tailbone. So tailbone is just 1. Okay, done. So we are going to divide this into into these joints. So it's going to be very easy. So I hope you all have pens with you. Okay. Now I want you all to send me the picture. So once we are done with the procedure, because I don't want you to do any mistake, because this is treatment, it's not a game. Okay. So I want you to try this. Now just write C1 and C2 over here. C1 and C2.
Left hand.
Yeah, both the hand. Actually, this is bilateral concept. So anything you do it on your right hand is also for your left hand. Okay. So write C1, C2 on the last joint of little finger. Okay. C1, C2.
C1 and
C1, C2. Okay. And then the upper joint, I mean the middle joint, C3, C4. C3, C4. Okay. And then the first joint is C5, C6. C5, C6. Okay. Just do it on one hand. Okay. Just do it on one hand. So same thing applies for the other hand also, left and right hand. Okay. So now, so I've told you to draw this arrow mark, right? Pointing upwards. So can you see we are going upwards? C1, C2, C3, C4, C5, C6. Okay. So C7 is going to be on your ring finger last joint. C7. Okay. C7. Just write C7 and leave it. Okay. So now I'm going to explain how we are going to use this procedure. Okay. And then just take out, just use your right hand, right wrist joint. Just write lower backache, right lower backache over here. Or just write L. Short form is L. For upper backache, just write U over here. So L is over here, U is over here. Okay, fine. So those who have upper backache, how many of you are actually facing upper backache, cervical pain? Anyone? Yes, Suchitra ji. And then anyone? Nisha ji? Okay, Nisha ji also. Okay, fine. So those who have a pain in the cervical region, so covered this area completely with mutton seed. Only the front region with mutton seed. Okay. And then the next procedure is to put fenugreek seed. So I'll share the video of methi seed. So how to put methi seed on surgical tape. So make sure you take surgical tape and put methi seed in a single line. Okay, so collect the seed, just place it in a single line, and just like a ring, you're going to cover the entire joint, front and back. Okay, so the location is over here itself. So you all have hint over here. So those who have cervical pain, just put methi seed on all these three joints. Okay. Now, for example, if your cervical region is damaged or anything, it can be fracture, sprain, a slip disc bulge, joint effusion, whatever it is. So just place it on these joints. This is one of the most advanced treatment. Okay, and trust me, nobody will actually give this in a free session. So I know the value of this treatment. Many of them have spent lakhs of money only for their spine treatment, and this has helped them a lot. Okay, so those who have cervical pain, so make sure you put methi seed on both little finger, all three joints. Okay, completely with methi seed. Okay, make sure it's in a single line. Okay, single line. So cover till C7. C1, 2, 3, 4, 5, 6, 7. Okay, so cover this area completely with methi seed. Okay, and then talking about the thoracic region. So those who have pain in the mid back region, so it's T1, T2, T3. Everyone switch on your camera or just leave the meeting, please. Yes, switch on your camera. Yes, I'll give 1 minute. Please switch on your camera. Okay, fine. So now starting with T1, T2. So T1, T2. So any idea where is T1 and T2?
Ring finger second joint.
Yes, perfect. So ring finger, second joint. So this is going to be T1, T2, T3, T4. T1, T2. The upper joint is T3, T4. T3, T4. Okay. And then
Just tell everyone to mute also now because I
mute
can't see you.
okay. Yes, Suchitra ji. Okay, 1 second. I'll mute everyone's audio. So those who want to ask question, so we'll just keep it at the end. So no more distraction, interruption. Okay. Yeah. So done. T1, T2. This is T3, T4. Okay. So once you're done with this, so T5 and T6 on the middle joint, sorry, middle finger, last joint. T5, T6. Okay. T5, T6, T7, T8, T7, T8, T9, T10. T9, T10. Okay, so those have joined in right now. Hi again, everyone. So switch on your camera, everyone. Okay. So by here it's done. So T10, so T9, T10, and then index finger T11, T12. T11, T12, the last joint. T11, T12. Done? Okay. So those who have pain in the mid back region, you just have to put methi seed starting from T1 to T12. Okay. So I'll let you know where exactly T12 ends. Okay. So can you all just keep your hand straight? Okay. I want you to fold your arm. Fold your arm. Okay. So where your elbow touches, right? Where your elbow touches. Okay. So see the spine. So just come towards your mid back region. See where where's the exact spine region. So that's the location of T12. Okay. So I want you to fold your arm. Okay. Okay. Now touch your elbow joint. Okay. So keep it over here. Just keep it straight, everyone. Okay. Now see where is it going to align with your spine. Okay. So that's the location of T12. Okay. And then we have lumbar region. Lumbar region. So lumbar region starts from your index finger, middle joint. So those who have pain in the lumbar region, lower backache, so it starts from here. So this is L1, L2. L1, L2, L3, L4. L1, L2, L3, L4. Okay. And then L5 is on your thumb, first joint. So this is L5 and S1. Lumbar 5 and sacral 1. Okay. S1, then S2, S3, S2, S3, S2, S3, done. And then S4 and S5, S4, S5, and the coccyx region is going to be over here. So just keep your middle finger. So just go down. So this is the exact location. Okay. So here, we are done with all the curvatures. Okay. So this is not simple treatment. So this is advanced treatment. So those who have issue in any curvature, just put methi seed around that area, around the joint, and you'll see a lot of changes. Okay. Yeah. So now I want you to look at this picture. So anyway, I'm going to share the picture on the group. Okay. So this is the picture. Okay. So you can take screenshot if you want. Okay. Anyway, I'm going to share it, but you can take the screenshot. Okay. So this is how it looks. Okay, 1 second. Yeah, you can take the screenshot. Okay. Advanced treatment. Try this and see. There'll be a lot of changes. Okay. So Nishmita, I think you have slip disc or something, right? Nishmita, are you there? Yes. So which region it's affected? Is it the lower region or what exactly? You can unmute, Nishmita.
L4, L5.
L4 and L5. Okay. So L4 and L5 is affected. Okay. Now can you all just look at your hand and see where you have to put methi seed? So can you all unmute and say L4 and L5?
Index finger and thumb.
What?
Index finger and thumb.
Yes, perfect. So index finger upper joint, both thumb upper joint. Okay, so that's all. That's all. Okay. And then, yeah, so this is about the spine related issue. So this is not only for slip disc issue, but those who have any issue related to the spine, fracture, sprain, injury, anything, any medical term you come across the spine thing, just put methi seed. Okay, so this is on spine related issue. And then we have a tooth related problem. So those who have tooth related issue, right? So we have treatment procedure for that also. Okay. So what inspired me to learn acupressure? Okay. So when I was in 7th standard, so we all have this, a tooth will fall and, it'll start growing and everything. So when I was in 7th standard, 6th or 7th standard, my tooth had fallen, and I think for 6 to 7 years, it didn't grow at all. Okay. So when we did CBCT scan, my tooth was sleeping. So it was something like this. Okay. So I will share all the picture on the group. Okay. So just one magnet. Do you know the cost of one magnet? Anyone? Do you know the cost of one magnet?
10 or 20 rupees
No. Less
in
than that.
yellow.
Yes.
5 rupees,
No. One magnet. One single
1 rupee.
magnet.
No,
1
10
rupee, 1
magnets we
rupee,
are getting in the 10
Yes,
rupees.
Sushma ji,
1
perfect.
rupee,
1
1 rupee.
Okay. So this magnet which costs 1 rupee helped me, to my this one tooth related issue. Okay. So the direction of the tooth was proper and it came out also with the help of one magnet only, which will cost only 1 rupee. Okay, so that inspired me to learn acupressure. So I completed my dual degree. So I'm a psychology student, and then I did acupressure also. So with dual degree, I completed my bachelor's. So then so we have so many things when we talk about tooth. Okay, in color therapy, we all know what 0 indicates, what number 1 indicates, etc., etc. So those who have infection, so we all know it's 0 to 9 sedate. So those who have tooth infection, there is one protocol which is part of level 3. I want you to take this screenshot also. Yes, so this is the picture. So those who have tooth infection, just take black color sketch pen and apply it over here. In between, so on the lower region and the upper region. So I'll just show you one picture. Just a minute. So can you see this? On all the fingers, excluding the thumb. So don't put it on the thumb. So those who have any tooth related infection. I'm not talking about the cavities. I'm not talking about, sorry, not cavities. Those who have bleeding gum and all that. So there are types of tooth related issue. But I'm talking only about the infection and cavities. So those who have infection and cavities, just take black color sketch pen. Make sure you cut your nails. So we all grow nails for fashion, especially girls. We put nail polish and all. But I want you to cut your nails for better result. Okay, so just take black sketch pen and apply it on the top and bottom region. A single dot. Okay, so try it on all the fingers. Okay, and there's one more thing. So those who have tooth related issue on the upper region. So for the upper region, the treatment should be given on your hand. For the lower region, so if you have infection in the lower region, treatment should be given on your leg. Okay, so I'll show that picture as well. Okay, so anyone here who have cavities or something in the lower region?
Yes,
Lower
ma'am.
region?
I have.
I have sensitivity.
Sensitivity.
I
Okay.
have cavities.
Cavities. Okay. Yeah. So anyone here who have in the lower region?
Yes, I have on the lower and upper also, both sides.
Lower and the upper region. Okay.
Both sides.
Yes. Okay. So what you can do is, so you can just take, it's the same procedure. Just take black color sketch pen and put it on your leg. So make sure you exclude the biggest toe, the big toe. Okay. So yeah. So this is how it looks. Okay. So on all the toes, excluding the biggest toe. Just take black color and put it, you'll see the difference. Okay, and those who know how to use magnet, so the upper region, so can you all see this? 1 second, I'll just circle it. Okay, so can you all see this? The upper region, which is in yellow color. Okay, so how many of you can see this? I hope you all can see the yellow dots. So
Yes.
yellow dots is sedation. So the black color, which is in the lower region, so this is tonification. Okay, so this is tonification, and the upper one is sedation. Try this and see. For this also, you have to cut your nails. Make sure you use tiny magnets. So you get it in different.
All magnets.
Yeah, slow. The
All
smallest.
magnets.
Yes.
I'm having.
You
Wait.
have it, Sana? Okay.
Yes. I'm showing
Yes.
it.
Yes. Okay. So this is the thing, so those who have infection. Okay. And here we have so many other things like bleeding gums,
These are small magnets.
etc. etc. Yes, Sana. Yes, I'll just put you on spotlight. So can you just show it to our audience? Yes, Sana.
One side it's yellow and one side it's white.
White. Yes, yes. So can you see it's very tiny? It's very tiny. Okay, so these are the magnets.
So will this
Ma'am,
work on?
upper side we have to use, only upper side we have to put magnet.
No, on your finger also. Okay, so I'll show the picture again. Yanesh Mehta, thanks for asking this question. Okay, so I'll show the picture again. So those who have infection on the upper region, so this is how you're supposed to try. So can you see this? So the upper one is sedation, lower one is tonification. Okay.
But Pooja, whenever we have tooth pain or something on the upper region, so we
Yes.
have to put both, na?
Yeah.
Both, na? Black color.
Yeah. Yes, Suchitra ji.
Yes.
I
And
would.
for the magnet,
Yeah.
we have to put yellow color up or yellow color down. For
White
magnet, I'm
should
asking.
be down.
White should be up,
No.
down.
1 second.
White should be down.
No. So here, so the white
like
magnet should be over here, Suchitra ji.
Yes, because I have tiny magnets right now.
You have tiny
So,
magnets. Okay.
yes. So
Yes.
white color up. And for the down, which is one is black color, you shown the dot. So
Yeah,
what we
black
have
is
to,
there. So here, if I put white color, it won't be visible because the screen itself is in white color.
okay.
So for that, yes, Suchitra ji.
Mm.
Yes. Okay. So this is known as tonification. So whenever you put magnet and whenever you're showing it to others, or when you are looking at your own hand, if white is on top, it's known as tonification. If yellow is on top, it's sedation. Okay. And you won't believe it. So many of them have messaged me regarding TCM class from so many months. I want to start a TCM class, starting from the basic. And trust me, it's never going to be the same session. So maybe you would have joined 6 months back, 1 year back, 3 years back, but each and every session is going to be different, especially TCM class. Color therapy, it's the same thing, whatever you have learned. TCM, it's always different. So those are interested, it's for 3 days. I'll just let you know the details later. So the fees is very nominal. It's 200. So you can join the session. Okay, TCM class. Yeah, so now back to the session. So this is for tooth related issue, tooth related thing.
Pooja, can we apply colors also here?
Colors, yeah. So if you want to apply colors, make sure you use only black color on the top and bottom. Only
For
black.
both top and bottom.
Yeah. Yes, ma'am.
Okay.
Okay. Yes. So Poonam, yes, you want to ask something? Yes, Poonam.
I have a question
Yes.
that currently impacting, and if I want to show some points to anyone from far, like I am sitting here and someone is my skin and show them.
No, Poonam, I didn't get your question. Wait, I'll just switch on my switch
I
on.
was saying currently
Yeah, yes, Poonam.
I'm expecting. So if someone is getting consultation from me from far, like this Zoom meeting, so
Yes,
can
yes.
I draw the colors on my skin regarding the regions to show
Yeah.
the person?
Yes, definitely, yes. You
Because you
can,
said we cannot practice it or color on the specific points. So
yeah.
I was doubtful that should I be doing this or not.
Okay. So good question. So many therapists will usually join my sessions. So it's good that you asked this question. So many of you do this online consultation. So even I do online consultation. So ask that person to send a picture, mark it on their hand. So we all know how to edit on WhatsApp. So mark it on their finger and send the picture. So always do that. So never use your hand, or never color it on your hand and send it. Okay, because some people might have mark and everything, whatever the mark it is. So if you mark it on their hand, it's going to be 10 times clear for the other person. Okay, so those who have any tooth related infection, you can always try this black color on top and bottom. So make sure the person is not having long nails. Okay, so make sure it's cut. Yes, Kamakshi ji. Hello, Kamakshi ji. How are you?
Fine. Huh?
Fine, Kamakshi ji.
You told me that cervical spondylitis with nerve compression, those who are having, while they are bending their neck, I mean head, they are getting dizziness. Can we use the C1, C2 where actually pain is very much, we can see, no, with the probe and we can do it
Probe,
that.
yes.
Huh?
Perfect.
We can do
Yes, Kamakshi.
that is enough, no?
Yes. No, along with that, so those who have this issue, so how many of you have this issue whenever you're bending forward, or suddenly when you wake up, you'll have dizziness, vertigo issue. Okay. So Chitra ji, okay.
पूरा मुझे भी है
Indrajit aunty. Okay. So according to Ayurvedic acupressure, there are 10 tissues. How many of you remember? Rasa, Rakt, Mams, Ved, Asti, Maja, Shukra,
yes
Yeah. Okay. And then body hole concept. How many of you remember? This is ear hole. Okay. So the fact is interesting. The Ayurvedic acupressure itself has some kind of beauty. The knowledge is vast and awesome. So this is ear hole. So both little finger, middle joint is ear hole. Okay, and same thing goes with the cervical region also. So this is C1, C2, C3, C4, C5, C6. Okay, so those who have this vertigo issue, again, it can be due to cervical region also. Okay, now let's say if the person has met with an accident, okay, let's say some kind of injury which has affected the cervical region the most. Okay, what are the common symptoms? The person won't be able to lift their hand, their shoulder and everything. Suppose if you want to put bag or something, you can't even wear your bag, whatever it is. Okay, and the person will definitely have vertigo issue, vertigo, dizziness and everything. Okay, so here we are covering the cervical thing also, C1, C2, C3, and this is the ear hole joint. So it's like advanced treatment, Kamakshi ji.
Okay. Thank you.
Yes, Kamakshi. Okay, so yeah, so this is how we'll be learning in detail. Okay, so this is part of level 3, and why I have conducted this free session is because I've seen many people spending lakhs of money. Okay, many people, like, think nearly 12 lakhs, 15 lakhs only for their spine treatment. I want to share something which is just magical. So by the end of the session, I want to share something. So, just be online, everyone. So level 3 is going to start by next week. I'll announce the date. So we'll be covering so many things like color therapy, which is regarding spine issue and tooth related issue. So we'll be focusing more on the spine treatment, slip disc bulge, uh, degeneration. So so this is just basic. So whatever I've told is just basic of level 3. It's actually advanced treatment, but this is just ABCD of what you have learned. So we'll be focusing on degeneration, slip disc, etc., etc. Okay. uh, so this is part of level 3. Anyone can join in. So it's not only for those who have completed level 1, 2, 3 can join. So it's nothing like that. So again, we're going to start with Akash Vayu Agni Jal. So how it actually works, what are the points for calcium, vitamin, everything is going to be combined. So anyone can join the session. So the fee is going to be 1,800. So those who want to join session only for the slip disc, it's going to be 700. Okay, so if you want to join the session only for the spine treatment, it's 700. Those who want to join the session only for tooth related issue, it's 700. Okay, so those who want to join the the complete course, it's 1,800. Still, there are a lot of things we are going to cover with color therapy and everything. Okay, so those who are interested, you can join. I'll announce the date, and TCM class is going to start soon, very soon, about the 5-element theory and everything. Okay, now let me know one thing. So how many of you have spine issue which is related to nerve? Like, you might have that shocking kind of pain, nerve pulling sensation type of pain, etc.
Yes, I have. In toes, it is pulling. Not the sciatica, only toes.
Toes?
Toes ending, no? I
Okay,
have
toes
that.
ending. Okay.
Yes.
Yes, Kamakshi.
Electrical shock like that.
Yes. So those who have any nerve related issue, I think I think Neetaji or someone mentioned about tooth sensitivity. Tooth sensitivity, sciatica pain, anything which is connected to nerve, anything related to nerve, just take red color sketch pen and apply it on both index finger. So just keep your index finger like this. So face it towards your camera. Okay. So make sure it's in the corner. Okay. It's not on the yin side or yang side. So make sure you start from here and end it till here. So can you all feel the meeting point of these two bones? Yes. Yeah. So till here I want to extend red color.
Okay, this will affect this sciatica pain also. This is useful for sciatica also?
Sciatica also, yes, aunty.
This tendon meridian. Yes, this tendon meridian.
Yes.
I know about this. It is related to nerve degeneration. So
Nerve
I am putting the red color on that.
Yes.
But I don't know till now only I know that it is useful for sciatica pain also.
Sciatica pain, yes, sciatica pain, tooth sensitivity, nerve sensitivity, and some people, their hand will keep shivering like this. So due to nerve issue. Yes.
Okay.
So for that also you can put red color.
Yeah, Pooja, like this?
Yeah, yes, auntie. So Indrajit auntie, she is the one who will always share awesome feedback. So would you like to share anything on this, Indrajit auntie?
हाँ पूजा, मैंने तो बहुत जन को ट्राई किया है ये वाला।
ओके।
हाँ, खुद भी करती हूँ, मेरा भी कभी कभी हो जाता है, ज्यादा टाइम बैठते हैं तो, क्योंकि मेरा काम स्टिचिंग का है तो बैठती हूँ तो फिर पेन होता है कभी कभी। तो मैं खुद भी करती हूँ, बहुत जन को भी करवाया, सबको ही फीडबैक अच्छा मिला है मुझे।
बहुत अच्छा मिला आंटी। स्पेशली कौन सा प्रॉब्लम आंटी स्पेशली?
जैसे मोस्टली लेग का जैसे नर्व खींच जाता है किसी किसी का, जब बैक में कभी कभी ऐसा होता है कि हैवीनेस लग रहा हो, जब पेन कोई नर्व जैसे प्रेशर आ रहा है तो उसके लिए किया था, बहुत अच्छा रिजल्ट आया सबका।
Awesome. Very nice.
हम्म।
Great. So this is not only for sciatica, but for any nerve sensitivity issue. So it can just be anything. Okay, nerve related issue. Okay. Yes. Awesome, auntie. And then, yes. Okay. So any questions regarding the session? Anyone?
Pooja,
Yeah. Yes, Suchitra ji.
just for the wrist, we have to put lower back pain here,
Yeah.
butter seed,
Yes.
and the upper back pain is here.
Here. Yes.
Correct? So both hands or only right hand?
Only on right hand.
Only on right hand.
Yes.
Huh?
Yes.
So because my upper back is okay, matlab thorax is okay, but
Oh.
lumbar is painful.
Painful. Okay.
हाँ, मतलब last L5 to till coccyx.
Okay.
It pains a lot, and the left side of my hip pains a lot.
Okay. Yes. So it's starting
So,
from L5. So can you tell me the joints? But today's session. From where
L5.
should I put my thesis?
Index, thumb
Thumb.
first joint.
And
Yes. So starting from the thumb region. Okay. So if it's L4, you can put it over here, but L5. So starting from here, so both thumb, upper joint, lower joint, and then over here as well. So here you can just take some 10 seeds, 10 methi seeds and paste it over here. Yes. Suchitra ji, you're on mute.
This part.
Yeah, this point, the middle region.
Yeah, middle region. This
Here
part,
exactly.
correct?
Yes.
And here also for the lower back.
Lower back. Yeah. Yes, Suchitra. Here you can put mutter seed.
Mutter seed.
Yes. So if you have cluster magnet, you can put 5
I
cluster.
have.
Oh, you have?
I have cluster. Yes.
Okay. Then you can put.
I have the star magnet also. I have.
Is it okay?
Ma'am, cluster magnet is better than mother seed or what?
Yes, cluster magnet is always the first preference. So those who don't have cluster can opt for mutter seed.
How much I have to put cluster magnet? 5?
5, Suchitra ji.
Okay.
5. Yes.
On the wrist joint only, no?
What Kamakshi?
Cluster magnet.
A cluster magnet.
Cluster magnet on wrist joint or
joint.
Below the wrist?
No, on the wrist joint. On the wrist joint.
Okay.
Yes. Okay. Yes. And then also those are joining the session, right? Especially for the slip disc and everything. So you get the PDF also. Okay. So I'll just show you how it looks. Okay. Because many of them don't have an idea of how it's going to be. Okay. So this is how it's going to be. Okay. For example, if the person is having pain or fracture anything, right? So the location will change. Okay, so this is sedation, this is tonification. Okay, this is how everything will be given in detail. So you need not sit and plot the points and all. So you have PDF with you. Okay, so along with PDF, along with the recording. So recording will be available for 1 year. You can watch anytime. Okay, but don't be careless. So don't procrastinate. So don't be like, recording is there, so I want to attend live session. So don't do that. So those who are interested can definitely join the session. And we have something known as spiral meridian. Okay, so I will teach about spiral meridian also. So so those who are interested can join in. Okay, so instead of spending lakhs of money for your whatever spine issue, whatever it is, everything is going to be covered in this session. Slip disc, degeneration, joint effusion, disc bulge, etc. Everything. Okay, so so I'll announce the dates and everything very soon. Okay, and then I told I'll share something special, right? Special remedy. Okay. So numerology, and few of them have joined the manifestation course. Okay. So we have code for those who have backache. Okay. So chronic backache. So this is for general backache. Okay. So if you've got backache, maybe from 1 week or 2 weeks or whatever it is. So this is for general backache. So the chord should be chanted for 48 times. So make sure you chant for 48 times or more than that. So we are specific about the numbers. It's going to give you best result. Either 48 times or 108 times. Okay. If possible, you can write and chant. Okay, so I will say the code. So it is 717181 533. So whenever there are two digits, you can't chant 533. So you have to say 533. Okay, so you have to break it down. So it's 7181 533. Okay, so those who have uh, backache in general can chant this code. Okay, but those who have sciatica pain, so those who have backache due to nerve issues, I think Nishmita can try this. Suchitra ji can try this.
Mm.
Okay, so though I want you to write this. So those who have backache due to sciatica pain or major nerve issue. Okay, so backache can also be due to some muscle catch. It can be due to joint pain, etc., etc. But here the problem is connected with nerve. Okay, so if you have nerve related issue and so anything which connects till your thigh region to calf muscle area. Okay, now let's say if the person is having spine issue. Okay, so it's not only the spine which is going to affect it, your extremities will be affected, your lumbar region, your legs. Some people won't have sensation at all, your fingers, your toes and everything. So those who have spine issue, nerve issue, and nerve which connects the thigh region till your toes. Okay, so it's for them. So the code is 8747 8747 838. Okay, 8747 838. Okay, this is amazing. Just try this 48 times or 108 times. If possible, write with blue pen only. So don't use green pen, black pen. So we have specific color for each code. So for both the code, it's going to be blue color. So normal ball pen, gel pen, anything is fine. Okay. So I would suggest you to use a ball pen. No ink pen, gel pen. So use ball pen. Okay. Yeah. Done. So done with the session. So I hope you all enjoyed the session. Yes.
So one question.
Yes. Yes, Suchitra ji. Yes.
Yeah, here I can put the cluster magnet also instead of methicillin. No, or we have to put methicillin only.
You can put Suchitra ji.
Okay.
Yes, yes. Indrajit.
पूजा हाँ कभी कभी ना ये फिंगर्स के जॉइंट्स पेन करती हैं बहुत
फिंगर्स का जॉइंट पेन
हाँ जी
ओके ओके
उसके लिए भी क्या मेथी सीड यूज करें कि कुछ और भी कर सकती है
इसके लिए आप जर्मन कॉन्सेप्ट का ट्राई कर सकते हैं जेडी 1 सेकेंड जेडी 2 and 3 sedation.
ओके
जेडी 2 and 3 sedation.
ओके थैंक यू
welcome.
मैम यूरिन इन्फेक्शन के लिए यहाँ पे लगा सकते हैं क्लस्टर मैग्नेट यूरिन इन्फेक्शन के लिए?
No, we'll stick to the topic.
Okay.
If somebody is talking about heart problem, brain, we are going out of the topic. For urine
Okay.
infection, it's here. Here exactly.
Okay.
Black color. No cluster magnet, only black color.
Okay. Thank you, ma'am.
Yes, welcome. Okay. Yes. So Poonam, yeah, one last question. Yes.
Ma'am, this is off the topic. I want to ask कि जब एक साल बाद recording खत्म होगी तो PDF will remain with us, ना?
Yeah, PDF will definitely be with you.
Okay.
Yes.
Okay. Thank you.
Okay, welcome. So take care, everyone. And yeah, so see you soon. Take care.
Thank
Bye.
you, ma'am.
Bye.
Thank you,
Bye.
Pooja. Thank you,
Welcome.
ma'am.
Yes, and post how was the session on the group, on the SKI group. So we'll share the
Sure.
recording. Yes.
Sure, ma'am.
Pooja, do we get this
Thank you.
recording?
Yeah, I will
Thank you,
share all
Pooja.
the recording. Yes.
Okay.
Yes.
Very
Bye.
nice.
Bye, everyone. See you.
Bye.
Namaste. Take care.
Thank you.
Welcome. Bye.